When your child is diagnosed with asthma, a lot of times the questions are, well, what is this and how do I treat it? The simplest way to think about how asthma affects your body or your child's body is that your airway is one long tube. It starts in our nose, goes down the back of our throat, and branches into smaller airways in our lungs. Asthma is a chronic inflammatory condition. There will be constriction of that muscle, and so a lot of twitching. There will also be a lot of mucus in that airway. This can manifest as many things, including wheezing and coughing. The goal of the inhalers, which is how we treat asthma, is to take that airway back to the nice, relaxed, smooth muscle that is mucus-free, and that way your child is functioning at their normal baseline level. Some of the common triggers of asthma include anything that causes an increase in mucus. So that can be allergies, that can be viruses and colds. Sometimes activity will cause that twitching in the airways, and you will notice that your child coughs with activity. Tobacco smoke, pollution, things like that.
Use your metered-dose inhaler with a spacer. The spacer helps you direct the medicine directly into the lungs rather than leaving much of it deposited on the way to the lungs. If your child is younger, I would recommend using a spacer that has a mask. Older children, about 3-4 years and up, typically can use a spacer without a mask. When you use your spacer, you want to use one inhalation of the MDI at a time. So if your prescription is for, say, 4 puffs, you don't use all 4 puffs together, but you do one at a time. The recommendations generally are that you shake the canister, attach it to the spacer, use one actuation, and then take a slow, deep breath. It's ideal if you can hold your breath for 5 or even 10 seconds. But I recognize that the younger children are not going to be able to do this. And also, when you're having an asthma attack, it's going to be pretty hard to hold your breath. So it's acceptable to take slow, deep breaths repeatedly for each actuation. So you could breathe in and out 5 times. The key here is to breathe very slowly so you can inhale that mist very gently rather than have a lot of it deposited in the back of your throat because it's gone in too quickly.
The first person to go and see is your medical provider. If you have any symptoms that are consistent with asthma, or if you're convinced that your child has asthma, your primary care provider is always the first person to go and see.
This is the person that you're going to interact with most often. This is the person who can take care of a vast majority of the asthmatics, and you should be able to create a plan that works for you in conjunction with your provider. Your primary care provider may decide to send you up to an allergist or a pulmonologist, as the case may be. But this is in the rare instances. Most cases of asthma truly are better managed in primary care.
A really good resource is something called an asthma action plan. You will get it from your physician's office, and a lot of the school nurses actually require that in their office also. So it's always a good idea to check and make sure that your child has an updated one. The asthma action plan consists of 3 zones. There's a green zone when your child is well, what daily medications to use. A yellow zone when they start to get sick, what medications should be used, and usually that's albuterol or the rescue inhaler or nebulizer. And then the red zone where you need to seek medical attention because they are truly past the point of taking care of things at home.
I consider asthma an allergy. It's oversimplifying it, but essentially it's an allergy in the lungs. When somebody's allergic to something, I think it makes perfect sense to try to avoid what causes that allergy in the first place. It does not make sense to keep being exposed to those very triggers and then try to fix the problem that ensues. I think it's important that we understand what are the triggers that are playing a part in your child's asthma. I like to class these triggers as things that are avoidable and things that perhaps you have no control over. I would want to work really hard on the things that we can control. So these could be things like, very obvious things like having pets in the home or smoking. It could be something a little more invisible like house dust mite and the chemicals that you use at home perhaps. So these are all things in your control to change. I believe that each of these allergic triggers in a sense stack up on top of each other. It may be that none of these things in themselves incite an asthma attack, but your child is being exposed to these things, there's ensuing inflammation, and your child is walking around just ready to have an asthma attack. And then something that you can't control will be the last straw to break the camel's back. The weather may change on you, the allergies might get out of control, your child might get sick, and that'll be the one thing that pushes your child into that area where there's an asthma attack. So work really hard to try and reduce those triggers that cause inflammation. What we can't achieve just by environmental control, we will use inhale steroids to further suppress. So the hope is that you suppress it enough that the very things that you cannot control cannot push your child over into the area where they have an asthma attack.